delegates. The topic is left ventricular diastolic dysfunction in patient with type 2 diabetes mellitus. In diabetes mellitus is a group of metabolic diseases resulting in hyperglycemia with disturbance in carbohydrate, fat and protein metabolism. Hyperglycemia chronic, if it leads to metabolic abnormalities, results in end organ damage. Diastolic dysfunction is the early sign of diabetic heart disease preceding diastolic damage. Few studies are done in India, so there is a need for further evaluation. The aim is to assess the left ventricular diastolic dysfunction in diabetic patient and its association with age, gender, duration and glycosylated hemoglobin. The materials and methods are cross-sectional study of 100 normal tested patients because it is one of the cofactor with type 2 diabetes and no clinical evidence of cardiovascular disease were enrolled by simple random selection in Department of Medicine. Semi-structure performer was used to record demographic profile, medication history, anthropometric measurements, height, weight, waist circumference, complete blood count, liver and renal function test, fasting and postprandial blood sugar, and HbA1c lipid profile. Electrocardiographic and echocardiography parameters were performed to assess left ventricular diastolic dysfunction. Data were analyzed statistically using statistical package for the social science. The results showed that 54 out of 100 patients of diabetes has diastolic dysfunction, out of which 46 has grade 1 and 8 were grade 2. This is the bar diagram showing the diastolic dysfunction grade 1 and grade 2. The prevalence of diastolic dysfunction was increased with age, duration of diabetes, and if the HbA1c is more than 7%, and it was not affected by gender. Discussion: as per the present study, the prevalence of the diastolic dysfunction was 54% in type 2 diabetes. In a study done by Yadawa, it was 47.8%. By Dr. Ashur K. et al. In 218, there is a typographical error area. It was concluded that patients with duration of diabetes of 6 years and more had a higher prevalence of diastolic dysfunction. A similar study by Fatima concluded that the prevalence of diastolic dysfunction was prevalent in a significant proportion in type 2 diabetic patient, with 56% grade 1 and 30% in grade 2, 13.3% in grade 3. So conclude that the study conducted in asymptomatic normotensive patient with type 2 diabetes have heart failure with preserved ejection fraction, that is more than 50%, were associated with gender, age, duration of diabetes and HbA1c as a factor which might influence. Thank you.